Hello, welcome everyone. Thank you for joining us today. I'm Juliana Kerr, and I'm now a Senior Program Director for Migration at the Walder Foundation, but also the former Director of Global Cities at the Chicago Council on Global Affairs. And it is my pleasure to welcome you all to today's program on confronting COVID-19 in Latin American cities. Before we get started, we do have some housekeeping remarks. For nearly a century, the Council has provided an independent, nonpartisan platform for a variety of different voices to promote deeper global understanding and active U.S. engagement in the world. If you haven't done so already, I encourage you to visit thechicagocouncil.org to learn more about membership and other ways you can support the Chicago Council on Global Affairs as they provide relevant and timely global affairs content during this challenging time. Today's program is part of the Council's work on global cities, which is made possible with the generous support of lead sponsors, AbbVie, the Robert R. McCormick Foundation, the Pritzker Foundation, UL, the key partner Financial Times, and other contributing sponsors and partners. This event is on the record, and we welcome your social media engagement. You will have an opportunity to submit questions through the program by typing CCGA Live into your browser, and I will be taking questions through that system. And finally, as a reminder, the views expressed by individuals during this program are their own and do not represent the institutional positions or the views of the Council. So for today, we have three insightful speakers joining us from 3 countries in Latin America that are really in the news on the COVID-19 response. We have Claudio Rego from Chile, who served as the mayor of Peñalolén, and then as governor of the Santiago metropolitan region from 2014 to 2018. He's also a distinguished fellow on global cities at the Council. Eduardo Paes is calling in from Brazil, who served as the mayor of Rio de Janeiro from 2009 to 2016. And Mauricio Rodas from Ecuador, who served as the mayor of Quito from 2014 to 2019, and is also a distinguished fellow on global cities at the Chicago Council. So in preparation for today's conversation, I did kind of go back and look at the timeline of news coverage here in the United States from when we first heard about the virus breaking out and the stories that kind of trickled from there through the declaration of a national emergency in the United States in mid-March. There's actually an article in January about a Chicago woman who was the second patient in the United States with the virus. And there's a lot of criticism right now in the United States that we were late to prepare, late to react, and that we wasted time. In the meantime, there's a lot of attention now focusing on Latin America as the next hotspot where this virus is breaking out, and also the really severe challenges that the region will face because of its deep economic inequities, fragile public health system, and really dense cities. A lot of the coverage right now on Latin American cities is that it's going to be very serious and enduring effects. So to tee up the conversation, we really wanted to hear from our former mayors who are in country, and they can share real time what's going on, what the crisis looks like, and how their countries and cities are responding. To kick off, I wanted to just do a quick round with all 3 of you. So thank you again for being here. And we'll start with you, Claudio. If you could just briefly state the current situation. What is it like? What is the level of preparedness? And what does it feel like right now in Santiago?
I would say that there's a lot of concern in the country. We have national curfew from 10 p.m. to 5 a.m. every day for the last 3 weeks. We have a quarantine for certain boroughs of big cities or complete cities, but it's not a national quarantine, so it will depend. Right now, we have some cities that have only half of the city subject to quarantine. Today we get to the number of 5,500 people infected, positive, with 48 deaths. Even though it's a big number for the case of Latin America, one of the features of the way the country has been approaching this, because we have a national centralized system. The Minister of Health is running all the strategy for the country. They had taken over even the private sector providers of health. So we have a complete mandate, and every day we have seen the rate of growth of infection and death going down. The number is going up, of course, but the rate is going down. However, our greatest fear is that we're still kind of in the late summer in Chile. And on a normal year, we have a lot of people with a respiratory disease in the winter. So if the wave of the COVID gets to the normal wave of respiratory disease, we will have a big overcrowded public health system. Right now, 50% of the beds in the country, critical beds, are already taken. So we don't have that much more space.
Great. Let's go to you, Mauricio. Can you just briefly describe the situation in Quito?
Well, thank you so much, Juliana. Thank you to the Council, and it's great to share this panel with two great friends like Claudio and Eduardo. Well, the situation in Ecuador, please let me start by mentioning the situation in Ecuador. It's pretty bad, I would say. Ecuador is the second country with the largest number of confirmed cases in all of South America, only after Brazil. But of course, Ecuador is much smaller. We are one of the countries with the fastest growing curve in all of the world. So that's something to be very wary and concerned about. We have, as of today, around 4,500 confirmed cases in the country. But something that is particularly interesting is that 60% of those cases are located in just one city, in Guayaquil. The metropolitan area of Guayaquil has more than 2,700 confirmed cases, whereas Quito has around 400 cases, so that's 10% of the national total. We've been in a national lockdown for almost 3 weeks now. The first confirmed case in Ecuador was discovered in February 29th. Then on March 17th, we had a mandatory lockdown with few exceptions, of course, people working in grocery stores, supermarkets, the health system, etc. We are having a curfew, a mandatory curfew starting every day at 2 p.m. nationwide. So all of these measures have been in place, and we are kind of witnessing a slight flattening of the curve during the past few days. But of course, we cannot rest assured because of that, because indeed we are looking at having the peak during the next 2 weeks at the country level. So again, this is a very tricky situation, like in the rest of the world. You might ask why there's so many cases in Guayaquil. Well, in Guayaquil, this is kind of interesting because since Ecuador is in the middle of the world, Guayaquil and the coastal region follows the Southern Hemisphere school calendar, as opposed to Quito and the highlands, which follows the Northern Hemisphere school calendar. So when the outbreak happened in Europe and in other places of the world, many people from Guayaquil were spending holidays abroad and then came back infected. That's one of the reasons. And the second is that not everybody followed the mandatory lockdown in these places. These are very hot places. So it's really difficult in poor areas to have, people living in small houses without air conditioning, being inside the whole day. So many people didn't pay attention to the mandatory lockdown, and unfortunately, we are witnessing the consequences of that.
Yeah, thank you. We've definitely been reading about the impact of the tourism and travel and what that's done and bringing back. Eduardo, let's talk about Brazil and Rio. If you could briefly describe what the situation looks like there, and we'll get into the politics soon enough.
Sure. Well, it's a pleasure being here with two great friends and with you, Juliana. First thing, we just got some new figures from today in Brazil. We just reached around 19,000 cases, which I think it's very low compared to what it's what's going on, because Brazil has been testing not enough. We just had around 80,000 tests. We reached today 800 deaths, so it rose from maybe something around 610 yesterday to 800 today. So the figures are becoming worse and worse. We don't have a national curfew. What we have are some measures taken by most of the governors, most of the mayors, on quarantine, on social isolation. People asking those that are not needed at work, that they stay at home, which I think most of the population that can stay at home is already doing that. Obviously, the issue is the ones that are not capable of staying home, and they have to work in what we call essential activities. These are not stay at home. So, but I think that most of the big cities, obviously São Paulo has the largest numbers of cases and deaths. Rio is the second one. There are two cities, Manaus, which is the capital of the state of Amazon. It's already, when you look at the figures there, the situation is becoming really bad. And Fortaleza, which is in the northeast of the country, the state of Ceará, is also a city that's been suffering a lot. But obviously, with the size of Brazil, with the so many cities that we have in the country, there's a lot of differences between each state and each region. But it's a tough situation. It's not an easy one. And we, as Mauricio said, in Ecuador, we expect that in the next 2 weeks, we'll reach our peak. So, I mean, the press is helping a lot. The role of state and local level has been very, very important. There's a society, the institutions in Brazil are moving well on that matter.
That's good. All right. Well, thank you. Thank you for those introductions. We want to get into a lot of what you all three of you have already raised, and now is an opportunity to kind of dig in a little bit more. And Claudio, we can start with you. You started already talking about the concern around the healthcare system and the beds. If you want to talk more about really the biggest challenge that you're experiencing, that you see coming, both for the city and for the country, and then what are the plans right now to respond, if you could comment on that.
Well, I think as all the cases with Mauricio and Eduardo, we need a lot of social conscience, both from employers and workers and citizens. I think, as in the case of Brazil, as Eduardo was mentioning, we had in the mayors a very strong voice demanding from the national government more tough measures, and also more economic and social support, because we have two challenges that go hand in hand here. One is the health challenge, and as I mentioned, we are afraid of the winter because on a normal year, we have problems with respiratory diseases in the winter. If you add on top of that COVID, it can be a very dangerous mix. But also it's the matter of enterprises. As you know, we had a big social uprise and protests in the last 3 months, 4 months in Chile that were already a challenge for small and medium enterprises. And now we have COVID. So the government is making up an economic rescue package that right now has added up to 7.5 of the GDP. We think that is still too low, but the government keep on saying that they are coming up with new measures. Actually, today they announced a $5,000 million package, which in our case is significant in terms of the national GDP, mainly focusing on collateral for loans for medium and small enterprises, a subsidy for protecting the labor. So in Chile right now, as a mandatory law, if you are not in the capacity to keep on paying your workers, you can apply to this subsidy, and the state will pay the salary of your workers for 3 months, 70% of that salary. So we are coming up with a package. I think it's still not enough, because if we are demanding people to stay at home, especially independent workers, who's going to look after them? And they have to leave, they have to feed their families. So I don't know. We are, right now, I would say people are feeling confident in the sense that we're lowering the curve and we don't have that many people dead. But we are afraid that in 3 more weeks, because of the mix with the winter disease, this can get a lot worse. So economic support for families and for medium and small enterprises, and also this national unified command of the health system, which I think has been very helpful so far.
Yeah, you've pointed out, one of the big debates that we're seeing, in cities here in Chicago and across the country of, the response on the economic plan versus the response on a health plan. And a lot of focus of, making sure that people have the economic wherewithal to get through this, but then losing a little bit of the focus on the healthcare response, right? What does it mean for the testing, for making sure that there's, masks, or just even beds? We were talking about the beds earlier. And I know that there's a lot of criticism for not focusing enough on a healthcare response and more on an economic response. Mauricio, let's turn to you about, just looking at the limited resources. And if you could, cities, Claudio just talked about cities having to ask for resources from the national government. We see that here in the United States as well. How is it working in Ecuador? And, you were former mayor, you were mayor when there was this big earthquake in Ecuador in 2016. You also had to mobilize resources quickly for a major crisis and response. If there's lessons that were learned from there that you want to bring into the conversation.
Well, I think that was a very interesting experience of city-to-city collaboration, even when the government is not efficient enough to respond immediately to this kind of crisis. Actually, when the 2016 earthquake took place, the Quito's firefighters were the first ones in arriving to ground zero, much earlier than the armed forces and the national government. It was because of that in a big city, the largest city in which the earthquake impacted, which is Manta, out of the 123 people that were rescued, 99 of them were rescued by Quito's firefighters because they were the first one in arriving to the area. There were a lot of lessons that we learned out of that experience. The first one is, even if you don't have a good political relationship with the national government, which I didn't have with the president at that time, President Correa, you need to coordinate, because this is not a political issue. This is about responsibility. So the coordination between national and local governments is absolutely key in this kind of circumstances. Unfortunately, it doesn't work that way all the time, but you should pursue that to happen. The second thing that we learned, I would say, is the importance of having a very strict and rigorous coordination among municipal agencies. So Quito was, again, very active in supporting our sister cities and provinces that were affected by the earthquake. And that was only possible because of a very, very solid coordination among agencies within the municipality. I would say a third very important point is to be very disciplined in the way you communicate things, right? Because you have to tell the truth, but you shouldn't panic the people unnecessarily. But you have to be transparent all the time. That's really, really important. And last but not least, I think you need to build very broad partnerships. You need to ask for the collaboration of the private sector, of civil society, of NGOs, and work together towards a very specific goal, which in the case of the earthquake was to support those that were suffering and to push for the recovery of the affected areas. Also, in this regard, steering citizen solidarity is really, really important. We managed to do that in Quito. We mobilized the great solidarity spirit from Quito citizens. We were able to send more than 2,000 tons of humanitarian aid from Quito to hundreds of communities that were affected by the earthquake. So even though, of course, it was a very different situation, I think these are lessons that could be applicable to any kind of crisis like the one we are suffering now with COVID-19.
Do you want to expand very briefly on the communications aspect, the panic versus building trust and being honest? What does it look like right now in Ecuador?
I think that even the government now recognizes that the information has not been that accurate. So even though we are concerned about that, of course, because we know that the numbers probably are much, much higher and much more concerning than what we think, And of course, that's a problem, but at least the government is acknowledging that. So what we're expecting is for that to be resolved as soon as possible, because, I mean, you cannot improve what you cannot measure accurately. So without reliable data, we're in a big problem. So we hope, we will be able to overcome that really soon.
Thank you. So Eduardo, both Claudio and Mauricio mentioned the need of cities to get support from the federal government. And Mauricio just said this is not a political issue, it is a responsibility. But in Brazil, it feels like it's gotten a little political. And if you could talk a little bit more about the situation with the cities and the state governments and how they're managing the national politics around this.
Well, I think everybody always says that we should always fight with our presence inside our home countries, not outside. But I'll be completely frank here and tell you all the truth. But the first thing to remember here is that Brazil is been going through an economic crisis since 2015. So we had, if you consider 2015 and 2016. Our GDP went down around 7.5%. In 17, 18, 19, it only grew around 1% each year. So we were already in a terrible economic situation. The unemployment rates above 10%. So it came in a very bad moment. And with the economic situation, Brazil has been passing through a political crisis that seems that will never end. I mean, even with the election of President Bolsonaro, there was supposed to be a new time. I mean, the political environment, I would say, only became worse during this period. So, I mean, it's not an easy time. I think the president, he's been in denial. That's very public. Everybody knows that all over the world. I mean, at the first moment, he created this antagonism between the health issues and the economic problems. I mean, as we had a choice. I mean, and I think this is something that needs to be very clear. If you need to decide between economic problems and lives, we should go for lives. It took a while to the country, I mean, as institutions, as different levels of government, to kind of fight with the federal government, especially with the president. I don't know if you all heard, but in the last 2 days, the president has been fighting with his own Minister of Health, who doesn't agree with the president. So he was almost fired 2 days ago. It was a national movement for him not to fire the Minister of Health. So he's still in charge. So I think we're coming to a moment, and that I hope, I mean, the president, I just heard that he's going to speak again to the nation tonight in 2 hours. So we never know what's going to come out of that, what's going to be his message. But he's been fighting a lot with governors and mayors because of the quarantine. Basically, what he's saying is that this is a small flu, he calls gripezinha. I don't know if that's the correct word in Spanish. I mean, we have to smile or laugh a little bit because otherwise we would be crying. But it's a small flu that people will die, as it is acceptable that people would die. But at the same time, I mean, the good news is that Brazilian institutions are working well. The mayors are moving well. The government, their state governments, they're playing a very important role. They're being really open to the people, and that's very important, as Mauricio said. I mean, we need to deal with numbers. So, I mean, it's a very bad political moment, and Brazil is doing the contrary that we should be doing. I mean, everybody should be working together in the same path, in the same way, and that's not happening, unfortunately.
Thank you. Claudio, let's go back to you. You were talking about the economic packages that are going out to the people and this plan for helping, get through this particular crisis. But overall, I mean, you did briefly mention the protests that Chile was experiencing. over the several months, late 2019, Chile was always in the news with the economic tensions and social unrest. And so what do you think is going to be the solution for moving forward, kind of that big economic recovery plan for the country? And is there a role for the cities to help rebuild the country? I'm thinking of the trade, the exports, relations with China, that's a big partner. So if you could comment a little bit about the economic recovery plan.
Okay, let me just go back to something that Mauricio said that I think is very, very important, which is the fine line between panic and not speaking with the truth. I think one of the interesting features what has happened in Chile is that even though we have a national government that has acknowledged the problem, contrary to the case of Bolsonaro in Brazil or AMLO in Mexico, we have had a civil society, National Medical Association, universities, mayors, requesting more information from the government. So if you see, the government had to make up a social table workforce where all these people are represented and they meet twice a week. And now the data that the government is giving out to the citizens is very detailed by city, how many tests, how many people die, how many people in, how many beds. So it's interesting how mayors and the civil society has pressed the national government to be more precise with data. When you have open data, very transparent, and you trust science rather than just populist statements, people are more confident and people tend to respond better. Okay, going directly to your question, I think we had one wave with this tsunami, was the social tsunami, starting last 18th of October 2019, and now we had this health tsunami. So it's two tsunamis in a row for Chilean economy, that even though it has its strengths in terms of fiscal discipline, we still have some room for more international debt for the country. I think we will need to be very creative because there are a lot of inequality in our economic model. This is kind of the world-wide crisis of capitalism, and Chile is one of the first ones to experience that. We have been doing well in growth, but not as well in equality. So how are we going to come out of this crisis? I don't have the answer, but I'm sure that people, both not only small, medium enterprises, not only workers, but even big companies, are looking after the state right now. After demonizing the state for many years in Chile and everywhere, people are saying, how can the state, in this moment of very exceptional crisis, give us a hand? So I think we're going to see a redefinition of rules in our economy. The state will come out to help different types of enterprises, but it won't be like a blank check. You want some rescue, you want some help, but okay, but take care of your own workers. So sometimes, like banks, banks are very good at asking for government support when they're in crisis. That was the case in the US, that was the case in Chile in '82. But now that they're a solvent industry, the society asking for them, okay, now you have to, and either you do it voluntarily or the government will make you help those people. And so it's interesting, the political debate right now. It's less ideological, I would say. It's very practical. And I think people, even very orthodox economists, are saying we need more state in a moment of crisis, not only for public health, which is very important, but also for the public support for the economy, especially for the people's economy. See, when we talk about the economic support in Chile, we're talking about the unemployed people, the independent people that are not getting their salaries because they're at home right now, small and medium enterprises that provide 80% of the employment that are going bankrupt right now. So now is the moment when you need a strong state that gives a generous hand to them.
So Eduardo, what Claudia was talking about, I can't help but think of those recommendations in a Brazilian context, right? The redefinition of rules, a strong state, and then applying that with the big questions around the favelas in the big cities, or the people in the prisons, right? There's been so many prison riots, and there's all these concerns that if the virus breaks out in these localities, if like what is the plan with the government to deal with that?
Well, let me make a comment on what Claudio just said. I mean, I could not miss the opportunity, but it's. I mean, sometimes it's even funny to see what's going on, especially in Brazil. I mean, we just had an election where in 2018, where a right-wing president won the election. Basically, his main issues were connected to a liberal message. I mean, less state. Let's privatize as much as we can. And then we come to this crisis. And then again, as Claudio said, everybody's saying, come on, state, help us. Help us, we need the state. So Brazil was going through a lot of pension reform, I mean, administrative reform, a lot of reforms. And at this moment, things are kind of stuck. And the state and the deficit, which was the fiscal deficit, which was a big problem. Now everybody accepts that we cannot look at it now. I mean, I'm not saying that Brazil doesn't need reforms, but it's great to see at this moment how our NHS, which is called in Brazil SUS, Sistema, it's the unified health system of the country. How is it working? I mean, in every small city in the country, there is a public facility there's a public health facility there. So, and this is what's making things not as bad as in Brazil as they could be. And that goes to the favelas. I mean, the penetration of the state in the favelas, in the poor areas, it's very big. I mean, obviously, it's a big problem. There was an important measure by the federal government. I mean, we kind of created at this moment a national minimum wage. So everyone will be getting some money from the federal government. If you are, we have to say that 50% of the Brazilians are in the informality. So they are not formal employees. They are street vendors. I mean, they do things that needs people on the streets. So when you don't have a lot of people on the streets, these people are not capable of getting any money or making any money. So every Brazilian citizen, I mean, there are some rules, obviously. They're getting 600 reais. That would be around, I mean, dollars too high these days here, but that would be around $150. So everybody's getting that minimum wage now for the next 3 months. I mean, and there are some federal policies also for big companies, for mid-sized companies, for smaller companies. So I would say that there's a big effort at this moment, and without people talking about the size of the state or the fiscal deficit that we will face, obviously, by the end of the year, but taking into account that human lives are much more important than anything else. So, but again, we know that this crisis will make us all think of how should we keep moving things in the world, how we run our cities, how we run our economies, how the state is run, what's the role of the private sector. And at this moment, it's important for us to focus on some of these issues. So state is important. State needs to get things done.
But can we try to get to the question of the favelas? I know that there's in our online feed here, there's a lot of questions coming in about what Brazil, if it's at the state level or at the municipal level, of really addressing this, the chance that this virus will spread in the slums, and what they're doing to prevent that.
I mean, it's always tougher. I mean, when you go to TV and give the advice, okay, everybody stay at home. And if you get someone with the disease inside your home, you separate in a room and use a different toilet. I mean, there's a lot of people in Brazil, in Rio, that doesn't have many rooms in their houses. There's a lot of people living in small houses in the favelas. Most of the time, there are not more than one bathroom. So what's happening now, there are some measures with this help of the federal government, helping people to make some money. There are a lot of, and this is what's really working now, especially in Rio, where I see things closer. There are social movements in every favela of the city working together to get things done, to help, to try to let people know what's going on. Obviously, the the presence of the SUS, of the National Health System, helps a lot. So there's state present in most of these favelas these days. And obviously there are some measures, like the city of Rio. They created a program where older people, if they are living in a small house in the favela, they can go to a hotel in the city of Rio, will pay for that hotel. So there's a lot of propaganda in that now. But obviously, this is what worries us most. As we all know, the crisis came, the disease came to Latin America mostly, started with the rich people because they were in Europe, they were traveling abroad doing vacations, as Mauricio said in Guayaquil. Now it's moving to the favelas, it's moving to the poorest people. And that's where things will worry us most.
Yeah. Mauricio, there's a few questions here about mobilizing resources, not just within a country or, you know, with the federal government. I know we spend a lot of time thinking about the government, but other partners, you know, we can, and when I think of, you know, networks of mayors being able to plug into each other's expertise, or even more broadly with kind of big multilateral organizations, I don't know, the IDB, scientists, you know, what are those other resources out there that you think can get tapped into to help address this crisis?
Well, besides, of course, the support of multilateral organizations like development banks, which are key in this kind of situations, I also think that information exchange, success story sharing is extremely valuable. I am a big fan of that. I was while I was a mayor, and I'm still are. And I am learning literally every day about very exciting and innovative solutions that are coming up regarding the COVID-19 crisis. And that's because I think you have to learn from what's happening abroad. And for example, like a week or 10 days ago, I came across a very, very interesting solution that was designed by a very well-renowned urban expert like Carlo Ratti, whom I'm pretty sure most of you know very well. He's from MIT. He, along with a group of engineers and architects, designed what's called Cura. Cura are intensive care units installed in shipping containers. So they are, I mean, they have a very low cost. You can install them in literally within a few days. And they have the big advantage of being mobile, right? Which is the dynamic of COVID-19, because it's a disease that moves from one place to the other, which makes these kind of mobile solutions particularly relevant. So I came across with this solution. I knew Carlo from different urban spaces in which the both of us interacted. I called him, and then I put him in contact with the national government, and now they are already working together to bring the first 50 Cura units to Ecuador in the next several days. So this is the kind of solutions, very interesting, very innovative, that you can learn from by being, you know, active in this kind of international networks and initiatives. Something that I also found very interesting, and I learned about this just 2 days ago while I was participating in a webinar with different city representatives, is what's going on in Buenos Aires. So Buenos Aires, besides, you know, facing the initial outbreak and the immediate response to that, and they are doing that fairly effectively, they are already thinking ahead. So what Buenos Aires is doing is they are establishing a very broad task force with the participation of course, the city government, the private sector, NGOs, civil society, the academia, to think about the aftermath, to think about what's going to happen next, think about the future, because it is obvious that the COVID-19 phenomenon will change the urban dynamic in a dramatic way. We don't know how, but we should start thinking about it. So this task force is already thinking, for example, in the kind of regulations that could be applicable for restaurants, for social or cultural gatherings, for public transportation. So it is good to think ahead, but it's not only good because of the sake of it, but also because it gives people a light at the end of the tunnel. It is even a motivational tool for people to think about the future. It provides them with a positive mindset. And I think that in psychological terms, that's also very, very important under the current circumstances.
Thank you. And there's one question here, and you briefly touched on it, is a question around culture. And when we think of Latin American culture and warmth, proximity, togetherness, being outside, big families, extended families, friends, there's, what is it going to look like? Does anyone have any thoughts? And maybe we can just very briefly go through, starting with you, Eduardo, what your thoughts are on the impact on culture and this virus.
Well, I think we're going to wash more our hands at the end of that when we hug people. I don't think this is going to change a lot. I really don't. This is something that's very nice about our countries, about our culture. What I think it's going to happen, and I've been listening to, and I think what Mauricio said, it's very important. We need to look at the future, what's going to happen, how the cities are going to be. But it's very interesting because in the 20s of the last century, when we had the big diseases, when we had the Spanish flu, the American urbanization was, creating the suburbs, put people, kind of spread in the regions. But this is not, I don't see that as a solution. I think going through this crisis now, it shows that if we are closer to each other, if we have initiatives like the Paris 15 minutes or the Portland 20 minutes, whatever they call it, it's you have all the services in the same area. You have the social capital of people helping each other. So, obviously, this is a new world that we're going to face. There are the technological advantages are being used as it's on its limits now, which is, we always had Zoom as we're using now. We had Skype. We had a bunch of these things, but we wouldn't use it as much as we're doing now. So the world's going to change, the society is going to change. But I think some of our characters, some of our cultural aspects, these are not going to change. But we will need to think how we're going to move from here.
Okay. Well, we really only have a few minutes left for this conversation, but we do want to give you each an opportunity to offer some closing remarks. And so I'll start with you, Claudio, but if you could just really try to capture really what's the thing that is most concerning to you right now and the future of Santiago, of Chile, and in the context of this virus, what maybe do you have a real concrete recommendation? I know you don't have an economic plan for recovery, but if you have a recommendation for.
My concern will be precisely on the topic of culture. And even though I agree with Mauricio that it's important to think about the future and probably, issues about teleworking and distance learning and, national health services is going to be on top of the agenda for the future. But we're very bad at learning. What happened in Italy and Spain, which are our older brothers in Europe, we saw it 2 months ago and we didn't take measures. So sorry for being skeptical, but I think they were late. They had a football match in Italy where, thousands of people went and they went back to their countries and cities all sick. And the virus was already there. So I think we need to have a strong effort in terms of, explaining to the people what are the risks, because this is not over yet. We haven't got to the peak. The winter hasn't come to the southern hemisphere yet. And second, we need to mix that with some coercion. I'm not talking about a global lockout without measuring consequences, as Eduardo and Mauricio were saying. It's not the same to be in a lockout in an apartment with 100 meters for yourself than in a house with 30 meters for a family. So you need to take those coercive measures with very prudently. But people are in certain areas of Chile, and I imagine the same in Brazil and in Ecuador, are still not listening, that they have to stay at home and they have to maintain social distancing. So I don't know, we need to make a new mix because our culture is of kissing, hugging, and doing whatever we want. And this is a moment for discipline, for distance, and for obedience. And we're not that good at that in Latin America.
Thank you. Mauricio, do you want to share kind of your biggest concern or what you see and maybe a recommendation for addressing it?
Yes, sure. Well, besides what's obvious, I think we keep promoting and enforcing voluntary isolation and social distancing. I also think that it's extremely important to intensify and massify testing efforts, because we were talking about the lack of accurate information regarding the number of confirmed cases and deaths. Well, that's because we are lacking enough testing. So we should increase our efforts in that regard. And I also think there's a very important aspect. Claudio was talking about learning from experience, right? I think we should learn from the Ebola experience in Western Africa, right? At the beginning, all the efforts from the governments and international organizations were lacking effectiveness because they were not data-driven. I think we should correct that mistake right now. We should conduct all efforts under a data-driven perspective to make the use of resources the most cost-efficient possible. I think that's the kind of lessons we should learn from the past, and I'm pretty sure we will be much more successful in the future.
Thank you. And data-driven platforms, I know there are a lot of cities around the world making that open data portals available. Eduardo, a final word on your concerns and recommendations?
Well, just, I mean, I need to go with Claudio on that thing about planning. I mean, I was in China on the 11th of January when it started. I left on the 22nd of January. So, I mean, everyone, especially with how the world moves today, people traveling everywhere. I mean, everyone, every country should have got ready for that. I mean, it's unbelievable that, that things came as a surprise. They should not be a surprise. I mean, so obviously, and I don't say that's not only for Latin America, that's Europe, that's the US, that's everywhere. So we cannot stay on denial, when things move on. And everybody knew that there was not a little flu. I mean, only the president of Brazil thinks it's a little flu, but everybody knows it isn't. So I think planning is something that we need to learn, especially in these pandemic diseases. We need to be ready for that. That's what we should learn. And that's what worries me. So people should pay attention, no denial, and let's plan and respect what are the rules now and the orders now.
Yeah, thank you. I know that a lot of your cities have published resilience strategies in the past for how to prepare for different types of crises, mostly focused on infrastructure, but it seems like preparing for the spread of pandemics should now also be front and center on our city's response strategies. I want to thank all three of you for joining today's conversation, from calling in from your cities, and it was really important for us to hear from you. I also want to thank the attendees for tuning in for this conversation today. We want to remind everyone that this video is going to be available on Chicago Council social media channels and on its website after the programming. So please look for that and continue to engage on the social media. Thank you all. Stay safe, stay healthy, and I look forward to seeing you next time.
Thank you.
Good afternoon.
Bye-bye.